Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1. Questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Morning, Sarah. I'm Dr. Neil Strathmore. I'm a cardiologist, and you've been referred here from the Royal Children's Hospital for some further follow-up. So why don't you tell me a bit about yourself and what's been happening to you?
Well, I was born with a congenital heart, and I've had surgery in 1991 to correct that. And I was also, a pacemaker was also put in, and I've been seeing my cardiologist at the Royal Children's Hospital since then, and now I've come here.
So in 1991, how old were you?
I was 6.
And how old are you now?
I'm 23.
And so you obviously don't remember much about that, but what did your parents say was the problem with you when you had the surgery?
Well, they tried to explain what it was, which was transposition of the great vessels, but basically they told me that I was out of breath, and that's why I couldn't keep up with the other kids, so I was going to have an operation to make me better.
Do you have any memory at all of the surgery or of being in the hospital?
Yes. I remember the nurses, and I remember the playroom, and I remember finding it really difficult to walk after the surgery.
And so do you remember the fact that you weren't able to keep up with other children when you were little?
Not so much, but I remember my lips turning blue and my fingernails being blue and basically going blue when I ran out of breath or running too much.
So after you'd had the surgery, did you only ever have one lot of surgery, or did you have to have repeated operations?
It was just the one in 91.
Good. And so after that, how did you get on in terms of your exercise capacity?
I didn't start off doing too much, but then afterwards I had been doing ballet beforehand, so I continued on with that. And then I picked up some more dancing, and as I got fitter and older, I was doing that quite consistently.
So during your teenage years, how fit were you?
Fairly fit. I was doing about 5 hours of dance a week, so...
Gosh, that's quite a lot, really. That'd be quite tiring.
It was.
And so have you kept that going since you've left school?
I have, but definitely not as much because I've been busy with uni and things like that.
So how fit are you now?
Probably not as fit as I'd like to be, but I'm still taking classes and walking regularly.
So do you have any symptoms? Do you have any shortness of breath?
No, not really. I try to keep watching other people when I'm in classes and making sure that I'm not more out of breath than they are. But normally when I'm turning around, everyone seems to be as puffed.
So if you walk up a hill or walk up a flight of stairs, do you get short of breath?
A little bit, but not enough to be concerning.
So you think you're about the same fitness of other girls of your age?
I think so.
Okay, now what about your health otherwise? Do you have any other health problems?
No.
You've already said your breathing's okay. Do you have any cough or sputum?
No,
Any wheezing or asthma?
not at all.
Your waterworks, do you have any problems with your urine or bladder?
No.
What about your bowels? They're all okay?
Yep.
And your appetite, and you don't get any nausea or vomiting or anything like that?
No.
And do you get any headaches?
Headaches I get every now and then, but I think that's mainly to do with stress.
Okay. Do you smoke?
No.
Alcohol?
Yes.
How much?
Every now and then.
So on an average week, how much would you drink?
It depends. Probably just once a week.
Mm-hmm. And would that be 3 or 4 drinks or more than that?
Probably no more than that.
Okay. What about recreational drugs?
No.
Not at all? Good. All right. Now, do you ever have any pain in the chest?
No, not at all.
Do you notice palpitations where your heart's beating fast?
No.
And have you ever had any blackouts or dizzy spells?
No, not at all.
Do your ankles ever swell up?
No, not that I've noticed.
Mm-hmm. Have you had any problems with excessive bleeding or bruising?
I notice I bruise quite easily if I just bump into things, but not enough to be too much of an issue.
Okay. Is there any family history of any heart problems?
No, not at all.
None of your parents or siblings had any congenital heart problems?
Extract 2. Questions 13 to 24. You hear an obstetrician talking to a patient called Vanessa Gordon. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also he has a child from his first marriage and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon, because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks, that's great. I'm sure I'll have lots more questions at our next meeting.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now look at question 25. You hear a monologue of a doctor briefing about rubella disease. Now read the question.
Rubella is a contagious disease caused by a virus, which is also known as German measles. However, the disease is caused by a different virus than measles. With MMR vaccine, rubella disease can be prevented. This vaccine protects against 3 diseases: mumps, rubella, and measles. Rubella was a common disease in the US before the invention of vaccines. The last major epidemic occurred between 1964 to 1965, when there was an estimated 12.5 million rubella cases in the country. However, rubella was completely eradicated due to successful vaccination programs in the country since 2004.
Question 26. You hear a discussion about different types of kidney cancers. Now read the question.
Like any other cancer, kidney cancer starts when the normal cells in one or both kidneys mutate and grow aggressively, forming a tumor or mass, which can be benign or malignant. Kidney cancers that have originated elsewhere and metastasized to the kidney are clear cell adenocarcinoma, transitional cell carcinoma from the bladder, renal lymphoma, inverted papilloma carcinosarcoma, teratoma, and carcinoid tumor of the renal pelvis. Renal cell carcinoma is the most common type of kidney cancer that accounts for 80 to 85% of all cases. This develops within the microscopic filtering systems of the kidney, which are the tiny tubes that carry the urine to formation. Transitional cell carcinoma, also known as urothelial carcinoma, usually begins in the area where urine collects before moving to the bladder. Pathologically, this cancer is similar to bladder cancer and is treated like bladder cancer. Kidney sarcoma is a rare form of kidney cancer that is usually treated with surgery and chemotherapy. Sarcomas may be large and usually does not spread. Wilms tumor is a common type of kidney cancer that occurs among children and is treated differently than kidney cancers in adults. Common treatments for Wilms tumors are radiation therapy and chemotherapy. Squamous cell carcinoma, juxtaglomerular cell tumor, or rhinanoma, Bellini duct carcinoma, mesoblastic nephroma, mixed epithelial stromal tumors, or other types of kidney cancers.
Question 27. You hear a nurse briefing her colleague about a patient. Now read the question.
Michael Juarez, he's a 64-year-old here with onset AFib, a history of type 2 diabetes, and a stage 2 wound on his left sacrum. He's allergic to penicillin. He's married and lives at home with his wife, who has Alzheimer's. Okay. He's alert and oriented times 2, and he's unable to ambulate independently. OT worked with him yesterday. He responds verbally. We're actively titrating his amiodarone drip. His lungs are clear. His blood sugar was high before breakfast, and he got 7 units of insulin. His last bowel movement was 2 days ago. He's retaining urine due to BPH. He's on a cardiac diet and is due for a stress test at 10. Did you get all that?
Wow, this is a heavy load. I better get started.
There's a new admit coming from the ED. It's your turn to take it. He's coming to room 346, and the nurse will be calling with report.
Okay, thank you.
Good luck.
Question 28. You hear a discussion about common types of neuropathic pain. Now read the question.
While there are countless types of neuropathic pain, some of the prominent types include carpal tunnel syndrome. Is caused by nerve compression in the wrists and causes pain in the wrist, thumb and fingers. Central pain syndrome can occur after nervous system damage, such as a stroke. Degenerative disc disease, one may feel neuropathic back pain if it causes damage to the nerves entering or exiting the spine. Diabetic neuropathy causes stabbing pain in the hands and feet of some diabetic patients. Phantom limb pain can occur in some patients after a limb is amputated. Postherpetic neuralgia is brought on by an outbreak of shingles and persists after the condition has cleared. Pudendal neuralgia is a type of pelvic pain caused by compression of the pudendal nerve. Sciatica is caused by compression or irritation of the sciatic nerve and often results in shooting pain that radiates down the back of the leg. Trigeminal neuralgia is characterized by shooting neck and facial pain.
Question 29. You hear two doctors discussing about a new device to ease breathing difficulties in patients with chronic obstructive pulmonary disease. Now read the question.
Doctor, what about the new device that will ease breathing difficulty in patients with chronic obstructive pulmonary disease?
Decreasing the volume of lungs affected by emphysema or chronic obstructive pulmonary disease actually makes patients with the condition breathe more easily. If they take a breath due to the lung capacity, it causes shortness of breath. When we take a deep breath in, if it is hard to breathe up there, this is called shortness of breath, which our patients often experience. Therefore, reducing the lung volume significantly improves the quality of life. The new device resembling a valve is used for achieving this, and this is being tested in the US.
Question 30. You hear members of a hospital committee discussing problems in the X-ray department. Now read the question.
So next on the agenda is the problems in the X-ray department. Nick, would you like to fill us in here?
Well, as you all know, this is a very busy department, so we have 4 X-ray machines in all, including one in the fracture and orthopedic clinic area. But recently, one of the other X-ray machines developed a fault, and so we had to apply for authorization for the purchase of a new tube for it. There's been some kind of holdup with the paperwork, and while we've been waiting, patients are being brought into the fracture and orthopedic area for X-rays there instead. And of course, that's causing further congestion.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a veterinarian called Dr. Han Philip giving a presentation. You now have 90 seconds to read questions 31 to 36.
Hi, I'm Dr. Han Philip. First of all, thank you everyone for coming here tonight. Dogs can have a variety of back or spinal diseases and injuries. Slipped or protruding discs are very well known in longer back breeds of dogs like Dachshunds for example. But a disease you may not have heard of can be very devastating, and I have an interesting case to show you. The disease is called Wobbler's syndrome. Tucker is a 3-year-old rescued dog, who is very loved by his adoptive family. He is a Great Dane, but because he's adopted from a rescue, the family did not know anything about his medical history or breeding. However, at about 8 months after coming home, Tucker began showing some very subtle signs of lack of coordination and slipping on tile floors. Then one evening in normal play, he yelped out with severe pain in his neck. The next day, routine X-rays of the neck revealed a suspicion of a cervical malformation in the last 3 neck vertebrae. He was sent to a specialist in neurology for an exam and even an MRI, exactly as we have in human hospitals. It was done under a general anesthetic. The MRI shows very clearly 3 cervical vertebrae that are thickening and pressing inward on the spinal cord. This is called spinal stenosis, and it will cause slow progression of weakness and therefore the name Wobbler's syndrome, and eventually it will cause paralysis and, unfortunately, early euthanasia. It is an unfortunate and sad disease seen in many breeds, especially common in Doberman and Great Dane. The first signs are usually seen at 4 to 6 years of age in Dobermans, but much younger in Great Danes. The owners typically see their dog become wobbly or uncoordinated. You may hear of cures such as feeding low-calcium diet and acupuncture. But, none of these things have been proven to be of real benefit. Some Wobbler's dogs can be managed on steroids and restricted activity, but the only real cure is a spine surgery called modified dorsal laminectomy. It is a surgical procedure of the spine, which aims to provide access to a prolapsed disc and therefore relieve pressure on the spinal cord. This surgery can take place only once the location of the trouble spot is known. This procedure is also used for dogs with severe neurological damage to the hind limbs, bladder, or bowel, as a result of spinal cord compression. Dr. Larry Newman, a board-certified specialist and neurosurgeon in private practice at the Veterinary Referral Center, did this surgery on Tucker. It is an extremely delicate and precise operation. Special instruments are used to remove the tops of the affected vertebrae, which then decompress the spinal cord and allow it to function without the damaging pressure that will eventually cause pain and paralysis. Immediately after surgery, it is important the dog has strict rest for a period of weeks, to allow swelling and inflammation to subside. The dog requires appropriate pain relief, and for those with impaired limb or bladder or bowel function. Nursing care is essential to prevent bed sores or urine scald. In the intermediate term, physiotherapy such as hydrotherapy, massage, and passive movement exercises can help to maintain muscle tone and aid recovery. This allows the muscle to reattach to the operative area. Today, Tucker is recovered and a happy, healthy dog, who will live a normal life without worries of pain or paralysis. The cost of diagnostic scans is significant, at around $800 to $2,000. The surgical expertise and equipment needed means this is an expensive procedure, and you should expect to pay anywhere between $1,500 and $6,000. It should also be borne in mind the dog may need intensive care for a few days following surgery, which costs around $600 per night. Since the Tucker's owners had purchased pet insurance, the company paid 90% of the total cost and is a perfect example of how pet health insurance really pays. Tucker's owners caught these symptoms early, and it was really helpful for both the veterinarian and the specialists to work together for a perfect outcome. This also demonstrates how early detection of any problem and the help of the whole veterinary care team is so important for the precise treatment and complete cure. Where there is a recognized predisposition to disc disease, such as in the dachshund, the owner should avoid activities which place strain on the back. In addition, at the first indication of back pain, the dog should be strictly rested and given pain relief. Dogs that show signs of numbness on the back end, such as staggering, weakness, or poor coordination, should be rested and see a vet as soon as possible in order to receive appropriate therapy and limit damage.
Now look at Extract 2, questions 37 to 42. You hear the doctor giving a lecture to the junior doctors on lung carcinoid tumors. You have 90 seconds to read questions 37 to 42. We all know that cancer begins when the cells begin to grow out of control. Cells in any part of our body can become cancer and can metastasize to other parts. Significantly, lung carcinoid tumours are uncommon and grow slower compared with other types of lung cancers. Lung carcinoids are made up of special cells called neuroendocrine cells. Before we try to understand lung carcinoid tumours, it is essential to know something about the structure and functionings of the lungs, as well as the neuroendocrine system. Our right lung has 3 sections called lobes, and our left lung has 2 lobes. The left lung is smaller because the heart takes up room on that side. When we breathe in, air goes into the lungs through the trachea. The trachea divides into tubes called the bronchi that enter the lungs and further divide into smaller branches called the bronchioles. At the end of the bronchioles, there are tiny air sacs called alveoli, from where many tiny blood vessels run through. These blood vessels absorb oxygen into the bloodstream and pass carbon dioxide into the alveoli, which is exhaled. Therefore, the main function of the lungs are inhaling oxygen and exhaling carbon dioxide. A thin lining, known as the phleura, surrounds the lungs, which protects the lungs and helps them slide back and forth as they expand and contract while we breathe. Phleura capacity is the space inside our chest that contains the lungs. A dome-shaped thin muscle called the diaphragm below the lungs, which separates the chest from the abdomen. Therefore, while we breathe, the diaphragm moves up and down, forcing the air in and out of the lungs. Lung carcinoid tumours develop from the cells of the diffuse neuroendocrine system, made up of the cells that are similar to nerve cells and hormone-making endocrine cells. These cells do not form an actual organ like the thyroid or adrenal glands. Instead, these cells are scattered throughout the body in organs such as the intestines, stomach, and lungs. Neuroendocrine cells secrete hormones such as adrenaline and similar substances. This may help control airflow and blood flow in the lungs and may help control the growth of other types of lung cells. Neuroendocrine cells may detect the oxygen and carbon dioxide levels in the air we breathe and then discharge chemical messages to help the lungs adjust accordingly. For instance, people living at higher altitudes will have more lung neuroendocrine cells because of the decreased oxygen level in the air they breathe. At times, lung neuroendocrine cells undergo certain changes, causing them to grow big and form tumours. These are known as neuroendocrine cancers. Lung carcinoid tumours are a kind of neuroendocrine tumour. However, neuroendocrine tumours can form in any part of our body. Stomach is another common site for neuroendocrine tumour formation. There are 4 different types of neuroendocrine lung tumours. Starting with the aggressive growth of the cancer, the 4 types are small cell lung cancer, large cell neuroendocrine carcinoma, atypical carcinoid tumour, and typical carcinoid tumour. Small cell lung cancer is one of the aggressively growing and spreading tumours. Large cell neuroendocrine carcinoma is a rare type of cancer. It is a subcategory of non-small cell lung cancer, though it grows aggressively like small cell lung cancer. Typical and atypical carcinoid tumours are carcinoids that appear different under the microscope. Typical carcinoids grow slowly and they rarely spread beyond the lungs. 90% of the lung carcinoids are typical carcinoids. Atypical carcinoids grow a little faster and they are likely to spread to other organs. They contain more cells in the process of dividing and they appear more like a fast-growing tumour. Unlike the typical carcinoids, atypical carcinoids are uncommon. At times, carcinoids are classified by where they develop from inside the lung. Central carcinoids form in the bronchial walls near the center of the lungs, and most lung carcinoid tumors are central carcinoids, which are also typical carcinoids. Peripheral carcinoids form in the bronchioles towards the outer edges of the lungs.